Welcome to Mental Health Mini number 28, Postpartum Depression. Postpartum depression is something that a lot of women may have experienced following the birth of a child. There's three different categories of postpartum mood symptoms, starting with baby blues, and then it can worsen to postpartum depression, and very rarely, but possibly grow into postpartum psychosis. With baby blues, we often see worry, sadness, and fatigue for about 2 weeks after birth, and those symptoms tend to subside without treatment. It occurs in about 80% of women due to hormonal changes following birth, and it is lower in those that have a strong support system. Postpartum depression, however, has worsening symptoms of depression in the evening, extreme fatigue and irritability, appetite changes, sleep changes, decreased libido, and feelings of inadequacy, especially related to being a mother. It can last for several months and often will need therapy and medications to treat. It affects about 10 to 15% of women, and some nursing considerations is that we would want to assess the baby and the mother for safety. And if we do prescribe medications, we want to make sure it's compatible with breastfeeding if that mother chooses to breastfeed. Postpartum psychosis is much more rare, occurring in only about less than 1% of women. This includes a depressed mood, agitation, indecision, poor concentration, guilt, hallucinations, and delusions. Treatment often includes medications, therapy, and possible hospitalization in an inpatient setting. The psychosis can last for months, and we would especially want to assess the baby and the mother for safety. Again, we would be cognizant of any medications and how they interact with the breast milk. Contributing factors to developing postpartum depression includes those hormonal changes, as well as changes in metabolism, especially in the brain regions that correlate with depression. They can also have a family history that increases their risk, and some women also experience severe feelings of anxiety and depression while breastfeeding. Nursing considerations would include nursing problems such as risk to harm self or others, dehydration, neglect, and ineffective coping. For treatment, we can prescribe them antidepressants, antipsychotics if they have postpartum psychosis, and there's a specific therapy that's been approved by the FDA specifically for postpartum depression called Zulresso. This is administered IV and can be taken for about 2.5 days. As far as other treatments go, we can prescribe therapy such as psychotherapy, group therapy, and family counseling. Evaluation of effective treatment would include resolution of symptoms, no harm to the baby, no harm to the mother, improved education, and improved coping. And that wraps up our mental health mini on postpartum depression.